everyone, it's Sarah with RegisteredNurseRN.com, and in this video I want to share with you how I passed NCLEX first try with 75 questions. Okay, so I graduated from nursing school about the second week of May, and I didn't get my authorized to test my ATT until a little bit later, so I scheduled my NCLEX for June 11th, so that was the actual date I took it. Now, in between that time, from the time I graduated, because I graduated on a Saturday, that following Monday I started my first job, and I was hired on as a new nurse graduate where I was orienting with another nurse, and once I passed NCLEX, June 11th, I would be able to transition into working as a registered nurse. So during that time, I was working full-time 40 hours a week, which really didn't leave me a lot of time to practice NCLEX questions. So that really ties to my first point. You know, you don't know what's going to happen after graduation. Are you going to be working? What's going to be going on in your life? So you really want to make sure that you're prepping for NCLEX way ahead of time. And you know, we're in nursing school, we're taking exams, we're going to class, we're going to clinicals. So in a sense, we're always prepping for NCLEX. But there needs to be a time where you say, hey, I'm starting now. I want to start practicing questions every day, going back and reviewing all that material. And I started doing this during my winter break, and I actually started December 11th. I have a log where I actually logged all this out. And if you want to see that study log, you can access a link in the YouTube description below, and you'll see the days I studied, what I done, and how I prepped. So that really helped me because that next semester, because there was winter break, we're going into my spring semester, which is my last senior year, I had to take an exit exam. And most of you all have to take some type of exit exam, and mine was HESI, and that really helped me because here I am prepping for the exit HESI exam, which is like really a mock NCLEX exam. So I studied all throughout that time. So what I did is that, of course, I purchased some review study guides to help me out. So I was taking the exit HESI, so of course I purchased the HESI comprehensive review guide that they sell for their exam. So if you're taking like ATIs or something like that, purchase whatever you're going to need for that. Then on top of that, I got the Saunders comprehensive review guide. Really like that guide. I talk about that study guide a lot in my videos. It's about this thick, but it contains everything you really need to know, and it comes with software and lots of NCLEX practice questions to help you start prepping for that exam. So what I done December 11th is I took, you know, that comprehensive exam that came with the Saunders software, and it told me all my weaknesses of where I really need to study. It was like an assessment. So I printed that out, and I developed my study guide of how I was going to tackle studying for NCLEX based on my weaknesses. And so I would look at what I scored the lowest in, focus on that, and then I would go into the HESI study guide and I would read those topics. So let's just say gastrointestinal. So I read over GI disorders, everything I need to know, and I'd also go into the Saunders book. I would read about that same disorder, pay attention to those nursing interventions, and those signs and symptoms in pharmacology. But the biggest thing I would really concentrate on was understanding that pathophysiology behind that disease. Because that's why in all my lectures I really focus on the patho. Because if you can understand what is going on with that disease, whenever you get any question about it that's wanting to know like a nursing intervention or medication or sign and symptom, if you can pull your knowledge from that pathophysiology, even though you don't know those signs and symptoms, those nursing interventions right there, but if you apply that to the pathophysiology of how that disease works, you can eliminate answers and you can select the right one. So really concentrate on the pathophysiology of things because everything else just really clicks into place. And then after I would do that, read and review, I would go into the Saunders software, and if GI was my focus of the day, I would select in the software, I want to take GI questions. And I would take hundreds of questions, and I would try to do that every single day if I could. Some days, you know, things come up, but I would try to dedicate that. And after I take the questions, I would go back and read every single question again and read the rationale, even of the ones of why I got right, because maybe I guessed on it. And I would read it, try to understand it. If I didn't understand it, in the software it would tell you what page that information was on, so you could go back in the review guide, look at that material and look at it again. And I would just keep doing that over and over. I wouldn't memorize the answers to the questions. You can't do that. You have to really truly understand the material. So that's why it helps reading the rationales and going back and looking at the material. And next, what I would do to help me study even more is that I would go back into the software and I would select that I just wanted the software to give me just alternate format questions. So I would just practice those select all apply, hotspots, and all those other ones, because on NCLEX it's not just multiple choice. You will be getting those alternate format questions, and that really helped me by having those thrown at me in the software, of taking those to learn how to answer those questions on the exam. So that is what I did to prepare for NCLEX throughout the semester. Now, the week before I took NCLEX, I changed things up a little bit. What I did was that I took a little bit of time off from work because I didn't want to work a 12-hour shift, then that morning go take NCLEX because I would be tired and I wanted to be fresh and focused. In addition, what I did was that I changed the way I was studying. I was doing like a comprehensive review instead of focusing on individual subjects, because that's what NCLEX is going to do. They're going to test you on everything. So I was practicing lots of questions over every topic, reading those rationales and going back and reviewing. So now let me transition and let's talk about some tips you can take with you before you actually take the exam. Okay, so for me, this exam was really stressful because there's a lot riding on it. You know, I just got through a nursing program that was extremely hard, and now it feels like I'm done, but I actually now have to take this exam that will allow me to do what I've always dreamed of doing, of being a nurse. And it all comes down to this one exam. And I have a lot of people waiting on me, counting on me. You know, I have family wondering if I'm going to pass. I have my boss who wants me to pass so I can take the position. I have peers who are wondering if I'm going to pass. So there's a lot of pressure on you whenever you're going to take this. So one thing I recommend is not waiting too long to actually take the exam, because if you wait 6 months from when you graduate, year, whatever, this material that you just learned is going to start dwindling away. That's why as nurses, we have to always do continuing education hours. We have to be refreshing our knowledge, getting the latest knowledge on everything, because nursing, the medical field, is constantly changing. So you want to take it whenever you're fresh. In addition, you don't want to wait too long, because if you're on your social media account and you hear that the smartest person in your class that always beats you in your exam scores failed, that's really going to stress you out, because you're going to say, what in the world? They always beat me in class on tests and they didn't pass NCLEX, so I'm surely not going to pass NCLEX if they didn't pass. And that's going to stress you out even more, and you're going to already feel defeated. Another thing is, whenever you're actually taking the exam, don't go in there with expectations that you're just going to get 75 questions, or if you're taking the NCLEX pen, that you're just going to get 85 questions. Because whenever it doesn't shut off at that number, it goes to 76 or 86, you're going to feel like you failed. So whenever I went in there, I told myself I'm prepared to get all the questions. And whenever it did shut off at 75, I was relieved. But if it didn't, I was going to keep going, because I have actually heard of other nurses saying, you know, it didn't cut off at what I wanted it to cut off. I felt like I failed, and I just sort of gave up and just started answering and selecting questions, and they ended up failing. So go in there with the expectation of getting all the questions. And finally, whenever you're answering those questions, don't try to analyze the question itself in that, oh, this is a super easy question, this is a hard question. Because if you start thinking in that realm, like, it's giving me all easy questions, I must be doing bad because it's feeling hard for me and giving me all these easy questions so I can pass. So don't do that. Just answer the questions and just keep going. Don't analyze them. Just think, okay, what's the correct answer? And lastly, let's say that you do fail NCLEX, which it does happen. And when it does happen, it's very depressing. You're going to probably start questioning everything that you have done up to this point. You're probably going to say, you know, did I just waste 2 to 4 years of my life going through nursing school? Can't even pass this exam. And you're going to really start struggling at first whenever you find out you fail. But let me share this story with you. Whenever I first graduated, got my first job, I was precepted by this nurse, and she was an excellent preceptor, excellent nurse. She's a hard worker. She knew her nursing knowledge frontwards and backwards. Patients loved her, physicians loved her, and she's just really good. If you were going to think of an amazing, awesome, smart nurse, it would be this person. And one day we were talking, and she told me that she failed NCLEX first try, and I was shocked, because if anyone in the world is going to pass NCLEX first try, it would be this person. And it really just showed me that this test doesn't determine if you're going to be an awesome nurse or have that nursing knowledge to take care of your patients. It's just this exam that you got to pass to become licensed, to become a nurse, because you can be having a bad day when you take this exam, or you overanalyze the questions, you really psych yourself out. And so even amazing nurses like my preceptor fail NCLEX. So listen, if you do happen to fail the NCLEX exam, just sign up for a different test day and take it again. Because remember, you just got through nursing school, which is one of the most difficult undergraduate degrees to obtain. So you have what it takes to pass this exam. So give it all you got. Go in there, you can do this and become a nurse. So I hope those tips help you, and best wishes on your NCLEX exam. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.